What appealed to me in the Project ECHO program is that we learn from each other.
The collaboration. It's always good to talk to other facilities that have different perspectives, experiences, and just the knowledge that comes from many different areas.
If we can herald back to the days and look back on the days of the early pandemic, really there wasn't a lot of information about what was going on. And it was important to hear peers, nurses to nurses, doctors to doctors, administrators to administrators, to hear what they were doing at their facilities and what was working for them.
Allowing different facilities who may not normally get to speak to one another, interact with each other, the opportunity to share what's going well for their facilities, what gaps there are in training, and if they have any other solutions that other facilities might be able to tap into.
You will learn how a different facility solves a problem that you may not have thought about. And so you're able to bring those of their experiences or success stories over and implement them and see if that's probably what we needed to solve the problems that we had.
We also learn from each other, sharing ideas, the challenges that we have, and it's very important to us because we need that forum where we can all gather together virtually. We're all busy in our what we do in long-term care, but if we set aside an hour, that is really, really important to us where we can be better leaders to our staff.
A process that worked elsewhere, we were able to implement it and also had success. And it wasn't something that we thought about, so we learned to get in front of the problem before we had the problem.
It's also an opportunity when new regulations are put out or new rules or new infection prevention strategies. It will definitely help administrators and directors of nurses and infection preventionists and medical directors, as a matter of fact. Those are the key leaders that it's important to know that how do we interpret the regulation. So meeting for a specific time as soon as new regulations has been put forth is very valuable.
I would say that it's important to continue. Collaboration is such a critical part of success, and we cannot work in silos. So when you have subject matter experts, when you have other individuals who are in the same field that have similar challenges, coming together and talking and collaborating and brainstorming is extremely beneficial. And if we take the approach that it takes a community to address the issues that we have in healthcare, then we can't work by ourselves. So having the ECHO series is definitely one of the platforms that provides that collaboration. So I would love to see this continue. I think it's an important initiative, and I would hate to see that it ends.